And she proved her yesterday. Here now is former Lieutenant Governor of New York and author of Beating Obamacare, Betsy McCaughey. She's holding in her hand a copy, so she's read it. Betsy, the fact that all these are Beltway lobbyists. They claim to be for the doctors. They claim to be for the pediatricians. They claim to be, but they are Beltway lobbyists. They're all inside the Beltway. I would think it's a badge of honor for the people who put this together that they're against it.
Only 17% of physicians, for example, practicing physicians, belong to the AMA.
Plus, these are people, all these organizations were supporters of Obamacare, right?
That's right, exactly. But the fact is, this bill is good news if you're looking for a job, if you want to support your family. This is a job-producing bill. This bill repeals the job-killing employer mandate. It repeals $600 billion in job-killing taxes, including that odious 3.8% investment tax surcharge that discourages investment in new businesses.
But it's not a jobs bill. It's a health bill. And the big question, the primary question politicians have is, will it lower premiums? Premiums going up and deductions going way up. That's what bothers most Americans. Does it do anything for that?
Well, that's what Ted Cruz is concerned about, and he has a legitimate concern. But the House bill has a better provision in it. And when this bill is really a ball. We want to kick it down the field toward the conference between the House and the Senate so that we get a final bill that can land on the president's
But I got to push you on this, Betsy. Will it lower premiums as it's written now?
No, the Senate bill will not lower premiums sufficiently, but what it does do, and this is critically important, is it reforms Medicaid. This nation is in danger of drowning in Medicaid costs. We have 74 million people on Medicaid. That's 20 million more than on Medicare. Half of all the women who give birth in the United States have Medicaid pick up the tab. Medicaid was supposed to be a social safety net.
Right. It's like food stamps. There's been an explosion of welfare. Medicaid is a form of welfare, and therefore it's part of the fix. But another critical point that Rand Paul and others have made about it is that there's a $50 billion essential payout. It's essentially a payout for the insurance companies because they have to continue to pay for these pre-existing conditions. Does that qualify as a bailout, and is that a disqualifier for
No,
this bill?
It doesn't qualify as a bailout. What it does is it says, in order to keep people with pre-existing conditions in the insurance market, you have to pay the insurance companies somehow. Otherwise, insurance companies have to raise the premiums for everybody to cover those costs. The 5% of people with pre-existing conditions use 50% of the health care, right? So if you're going to charge them all the same premium, you have to somehow make it up to the insurance companies.
But it's a $50 billion bill that somehow has to be paid, and we, the taxpayers, pay it.
You are absolutely right. In the House version, it's set up as a fund in each state to pick up the extra costs for people with pre-existing conditions. One way or the other, the public...
We got to run, but the bottom line is you see this as a starter. It's a starting ball that's going to be kicked down the field.
That's right. If you want to get rid of the job-killing Obamacare, you need to pass this bill.
Betsy McCaughey, thank you very much. Melissa.